All right. LGHN webinar administrator, we're going to get started with the panel. The panel is understanding and addressing the impact of COVID-19 on the Hispanic Latino local government workforce. My name is Josh Franzel with the Mission Square Research Institute, formerly the Center for State and Local Government Excellence, and I'm really happy to be joined today by my colleague Rivka Levinson, Senior Research Manager with the Mission Square Research Institute, and Noel Bernal, City Manager of Brownsville, Texas. What we're going to do today is we're going to have Rivka go over the findings of recent research that our institute has done around how the pandemic is impacting the state and local workforce from a career outlook perspective, from a financial concerns perspective, from a workplace perspective, and then City Manager Bernal is going to walk us through what he's seeing, the impacts in Brownsville specifically. And then what we'll do is after that, open it up for any Q&A we might have. We have an hour today, so we hope to be able to dive into a lot of these issues in some depth. So with that, why don't I turn the floor over to Rivka. Rivka, could you walk us through the findings of our recent research, and then we'll go from there. Thank you.
Sure. Thanks so much, Josh. So good morning, good afternoon, everyone, depending where you are today. I'm pleased to be joining you to be talking about some of our recent work on the impact of COVID-19 on the public sector workforce. And so I'll be reviewing the results of our recent research on this topic area. And this is an online survey that we conducted of more than 1,200 full-time state and local government employees. And this survey was fielded in May of 2021. And when possible, I'm going to make comparisons between our May 2021 results and those of our results from October 2020 and May 2020 surveys. Now, the final data were weighted by gender, age, income, and industry type to reflect the distribution of the state and local government workforce, as found in the U.S. Census Bureau's current population survey and the U.S. Census of Governments. And so what I'd like to do is present to you some of our top line findings, but at the same time, I also want to make some notes about how these findings may be similar or different for our Hispanic, Latino, and Spanish descent participants, which comprised 14% of our survey sample. So I'm going to go through these main findings and, as I said, note some similarities and differences. So for the first time this survey round, we were able to ask in May 2021 about respondents' views about the COVID-19 vaccine. And of those that we surveyed, 70% said that they're fully vaccinated, with another 6% saying that they're partially vaccinated. That is, they've received the first of 2 doses, or it's been less than 2 weeks since their final dose. Meanwhile, 22% said they haven't been vaccinated, and only 1% of our respondents preferred not to answer this question. The vaccination rates among our Hispanic respondents were fairly similar, with 72% reporting that they were fully vaccinated and another 7% reporting that they were partially vaccinated. When asked the 3 most influential factors in their decision to get the vaccine, respondents were most likely to report that they're vaccinated to ensure their own personal health at 63%, to ensure the health of their friends and family, and to have the freedom to travel without worry. Among those who haven't received the vaccine, 22% said that they'll definitely or likely get the vaccine. Nearly half of the unvaccinated, on the other hand, said that they will definitely not or likely not get the vaccine. And a fairly large percentage, 29%, are undecided. We have similar numbers here for our Hispanic respondents. Among those state and local government workers who are undecided or don't plan to get the vaccine, the main reasons cited were a concern about the side effects of the vaccine, that they require more information about how well the vaccine works, and a lack of trust in government. We then asked respondents about their employer's stance on the vaccine, in terms of whether they encouraged it and whether they've been accommodating for those getting the vaccine. So by providing financial or other incentives, allowing paid time off for getting the vaccine and for the possible side effects afterwards, etc. Nearly 2 in 3 said that their employer has been somewhat or strongly encouraging of the vaccine, while 22% said their employer has been neutral. Only 8% said their employer has provided incentives for receiving the vaccine, and even fewer, 5%, said their employer has mandated it. Among Hispanic respondents, 12% said that they've been incentivized by their employer to receive the vaccine, and 10%, twice as many as the rest of our sample, said that it's been mandated. Respondents were also asked about their own views on the COVID vaccine. If you look at the figure on the bottom right, 45% said that government employers should mandate that employees get vaccinated against COVID-19. Meanwhile, 59% believe the vaccine will only be effective if everyone receives it, and 44% are concerned about whether their coworkers will get the vaccine. Here we saw similar percentages for Hispanic respondents. The next set of questions in our survey had to do with general COVID-19 concerns and the morale of employees. So as you can see on this graph, positive morale regarding work among the state and local government workers has increased over the past 6 months. While 41% of respondents said they had very or positive morale in October 2020, this number climbed to 56% in May of 2021. Positive morale was much higher among Hispanic respondents at 78%. Negative morale, on the other hand, decreased from 27% in October 2020 to 21% in May of 2021. And it was even lower with only 9% of Hispanic respondents reporting negative morale compared to the rest of our respondents. In May of 2021, respondents were most likely to report feeling stressed, burnt out, fatigued, or anxious about COVID-19 while they were at work. Since May of 2020, there have been large shifts in these top 3 emotions respondents are feeling, showing several distinct patterns. So while stress rose from May 2020 to October 2020, it essentially reverted back to its initial levels in May of 2021, as you can see in the top bars. Burnout fatigue, on the other hand, which also jumped from May to October 2020, went down slightly over the past 6 months, but it's nowhere near early pandemic levels. And meanwhile, levels of anxiety started out high in May of 2020, remained so in October 2020. The anxiety decreased significantly in May of 2021. So thinking about their job going forward, respondents continue to be most concerned about keeping their family safe from contracting COVID-19. This percentage has remained consistent, ranging from 81 to 83% over our 3 survey rounds. Among Hispanic respondents, this was just slightly lower at 78% reporting this concern. If you look at the second set of bars, while 64% remain concerned about staying protected from contracting COVID-19 at work, this number has dropped substantially over prior rounds of the survey. In contrast, this number was much higher, closer to earlier survey rounds among Hispanics, with 75% reporting concern about this. And concern about having one's benefits package reduced, pay reduced, hours reduced, or losing one's job all also showed declines from May to October 2020. Levels of concern among Hispanics were also in the 30 to 40% range for all of these indicators. When it comes to respondents' feelings about working in the public sector during the pandemic, 60% said they value serving their community during this difficult time. Among Hispanics, this was even higher at 71%. As you can see on the top set of bars of this graph, this finding has remained fairly consistent across all 3 surveyed time points. Feeling that the pandemic has made the public more aware of the importance of what they do, that working in the public sector during the pandemic is a source of pride, and that the pandemic makes their work feel more meaningful, showed small increases from October 2020 to May of 2021, with 40 to 48% endorsing each of these items. These were all slightly higher among Hispanics in the 50% range. And moving further down, when it comes to negative feelings about working in the public sector, the feeling that the risks they're taking during the pandemic are not on par with their compensation rose slightly from 48% in October 2020 to 50% in May of 2021. This number was very similar among Hispanics at 51%, And as shown in the circled set of bars at the bottom, feeling that working during the pandemic has made them consider changing jobs remained at 31% in May of 2021. This is the same as in October 2020 and 11 percentage points higher than May of 2020. The percentage of Hispanic respondents who said the pandemic has made them consider changing jobs was even higher at 36%. We also asked about levels of trust in government leaders to make appropriate decisions about employee safety during the pandemic. While trust in state and local government leaders had decreased from May to October 2020, it remains stable from October 2020 to May of 2021. For federal government leaders, trust jumped from a low of 29% in October of 2020 to 49% in May of 2021, a level of trust nearly equal to trust in state and local government leaders. Among Hispanic respondents, trust in state and local government leaders was fairly similar, and trust in federal government leaders was slightly higher at 54%. We next asked respondents about their financial concerns regarding the pandemic. 41% of our respondents said that they and their family have been negatively impacted financially by the pandemic, with 7% reporting that they've been negatively impacted financially to a significant extent. This is down from 56% and 54% who reported the negative financial impacts in May and October of 2020. Asked for the first time this survey round about positive financial impacts due to the pandemic, 14% reported any positive financial impact. Interestingly, this number was slightly higher among our Hispanic respondents, with 24% reporting any positive financial impact. Next, we asked to what extent debt, such as a mortgage, car loan, student loan, credit card debt, or medical debt, is a problem for them and their family. Over half, 54%, said that debt's either a major or minor problem. This is a slight decrease from October 2020 and May of 2020. Among Hispanic respondents, even more, 64%, said that debt is a problem. Meanwhile, 31% of state and local government workers have had to take on more debt since the start of the pandemic. This is the same percentage that reported having to do so in October of 2020. And among Hispanic respondents, 45% reported that they've had to take on more debt since the start of the pandemic, a much higher percentage than for our other respondents. We next asked a series of questions about emergency savings. Looking at the figure on the top left, we see that 71% of respondents said that prior to the pandemic, they and their family had an emergency fund set up to help pay for major unexpected expenses or to cover necessities if they lost their main source of income. This number was similar among Hispanic respondents. Moving to the figure at the bottom left, among those with an emergency fund, 38% have had to spend money from it since the start of the pandemic to make ends meet. This is similar to the 40% who had to do so in October 2020. But a much higher percentage of Hispanic respondents, 56%, said that they have had to spend down money from their emergency fund since the start of the pandemic to make ends meet. When we take a closer look at those who've had to spend down their entire emergency fund to make ends meet during the pandemic, we see that these respondents are significantly more likely to be female, Black or African American, under age 60, earning a household income of less than $100,000, working in education or health and human services, and concerned about their risk of exposure to COVID at work. We also asked several questions to understand how respondents' saving and spending habits have changed since the start of the pandemic. As you can see in this table, nearly 1 in 4, 23%, have reduced their savings for retirement. 1 in 3, 33%, have reduced their savings in general or for things other than retirement, and 41% have reduced their spending. Reductions in saving for retirement and spending were similar for Hispanic respondents, but reduction in savings in general was much higher for Hispanics at 51%. Respondents were also asked how concerned they are that the pandemic and the related economic crisis will impact being able to retire when they want. As shown in the top figure, concern was fairly steady from May of 2020 to October 2020 and May of 2021. Concern about this was higher among respondents at 53%. A similar trend can be seen at the bottom chart for being able to save enough to be financially secure throughout retirement. While 41% of respondents were very or extremely concerned about this in May of 2020, this number was 43% in both October 2020 and May of 2021. Again, we see here that concern was much higher among Hispanic respondents at 65% being concerned about being able to be financially secure throughout retirement. We also asked some questions to better understand the impact that COVID has had on respondents' employment outlook. So looking at the top figure, in May of 2021, more than 3 in 4 respondents said that the pandemic has impacted the nature of their job. That is what they do, how they work, how they go, where they work, how they go about the tasks required. This is slightly down from the 85% in May 2020 and the 82% in October who said that the nature of their job had changed. About 1 in 3 said that the pandemic has impacted the nature of their job significantly. Moving to the figure at the bottom, respondents were relatively split at all 3 time points in how difficult it has been to adjust to these changes. Among those reporting some impact to the nature of their work in May of 2021, 31% said it's been extremely or very difficult to adjust to these changes. This number is similar to the 32% in October 2020 who reported this, and slightly higher than the 26% in May of 2021. In contrast, 34% said that it had been not too difficult or not at all difficult to adjust to these changes, similar to the 37% in May of 2020 and the 33% in October of 2020. So to better understand the nature of how their job has changed, we asked respondents about their current work location. Well, 42% said they were working fully remotely in May 2020, and only 26% reported no remote work. The percentage working in person has continued to rise over the past year, jumping to 49% in October 2020 and increasing further to 58% in May of 2021. The number reporting no remote work among Hispanic respondents was fairly similar at 54%. Among those currently engaging in any remote work, only 23% have worked remotely prior to the pandemic. When asked how difficult it's been over the past 6 months to balance work and home life demands, about 1 in 4 said that it's been very or extremely difficult, and another 31% reported that it's been somewhat difficult. These numbers were slightly higher among Hispanic respondents, with 31% reporting that's been very or extremely difficult and 38% reporting that's been somewhat difficult. Balancing these competing demands may have been particularly challenging for the 71% of those with children or stepchildren under the age of 18 who had to work from home while also taking care of their kids over the past 6 months. 37% reported that they had to do so for a lengthy period of time. Among Hispanic respondents, this percentage was even higher, with 86% saying that they've had to take care of their kids while working from home, and 46% saying that they've had to do so for a lengthy period of time. Among those engaged in any in-person work in May of 2021 or prior to the pandemic, the majority, 74%, considered it at least somewhat risky in terms of their potential exposure to people who may have COVID. These numbers were 70% in May and 76% in October 2020. Meanwhile, 39% believe that it's very or extremely risky, down from 47% in October and similar to the 40% who reported this in May of 2020. Among our Hispanic respondents, many more, at 92%, said that working in person is at least somewhat risky in terms of exposure to COVID at work. 45% considered it very or extremely risky. So looking at the top figure, among those engaged in any in-person work in May of 2021, the majority felt that they did not have a choice as to whether or not to do so. 66% said that their employer didn't give them a choice, while 12% said that this was due to a factor outside of work. And moving to the bottom figure, when asked whether they think there will be more or less of an opportunity to work remotely than there was prior to the pandemic, just over 1 in 4 believe that there'll be significantly or somewhat more opportunity, while 32% think there'll be less opportunity and 42% anticipate no difference. These perceptions were very similar among Hispanic respondents. Finally, we asked a couple of questions about satisfaction with employer and benefits. So just over half of our respondents overall reported in May of 2021 that they are very or extremely satisfied with their employer overall. This is up slightly from the 46% in October. Only 12% said that they were not too satisfied or not at all satisfied, down from 17% in October. Among Hispanic respondents, an even higher percentage, 62%, reported being very or extremely satisfied with their employer. The three elements of their job that they were most satisfied with, circled on this graph, are job security. 66% were very or extremely satisfied. Their leave benefits at 65%, and their health insurance at 60%. These are the same three elements that they've been most satisfied with in October 2020. In contrast, going further down in the graph, less than 1/3 were very or extremely satisfied with their potential for career advancement, their salary, or their non-traditional benefits, such as tuition assistance, student loan repayment, employee assistance program, and child care assistance. Finally, respondents were asked to describe in their own words what 1 or 2 realistic actions their employer could take that would be most impactful in making their workplace a better place to work. As you can see circled on this figure, they were most likely to recommend the issuing of bonuses or raises at 21%, allowing work from home or remote work and flexible hours at 20%, and promoting safety by following CDC guidelines and providing or enforcing the use of PPE at 17%. It's also worth noting that 10% of respondents believe that their employer is doing everything that they can to help. So you can download this research and some of our other COVID-related research at slge.org/workforce. And I also have here some contact information. So please keep in touch with us at Mission Square Research Institute via email, Twitter, LinkedIn, and there's also my email below. And with that, I'm going to stop sharing my screen and turn things over to Noel.
All right, good morning. Thank you, Rivka. I'll work to complement what you have presented the best that I can, but let me share my screen here and begin to talk about the Brownsville story. So if y'all can please let me know once my screen is showing.
We can see it. Thank you.
The more of the ground floor example of a lot of the data that Rivka spoke to, because Brownsville in many respects is ground zero for a lot of this data, being a predominantly Hispanic community with some of the structural challenges that are expressed in some of this data. So my name is Noel. I've been in Brownsville almost 3 years, and Brownsville, I'll share some context here. Next slide. What I'll do here is I will bluff you guys first. I'll give you the bottom line up front. Here are the key areas that I want to speak to, and I'll speak to the tactics we use. I'll speak to the results and the outcomes that we're seeing. But for the most part, I'll talk about the overarching themes that you all can take away from today. And those are how we've used innovative approaches through our public health and economic development efforts, how we strategized and implemented a continuity plan, which is our way of overcoming the lack of our ability to rely on an emergency management plan like most cities faced, and then also what type of collaboration and partnerships we use through the organizational culture structure that we have in place to really tackle a lot of our issues in Brownsville. So a snapshot of Brownsville, the census has us closer to 200,000 now, but we're about 50% under the national median income. We have about 30% of our community under the poverty level. We do have a significant immigrant population. That goes back to our geography. We are a border community. Those figures then tied to other things like our high rate of food insecurity. We have lifestyle issues of higher incidences of diabetes in Brownsville, And also our educational attainment lags from that of the national standards and benchmarks. When it comes down to COVID, what that was manifested really in was in our health insurance and the percentage of our community that is not well insured. So pre-COVID, our population was 34.6%. Post-COVID or during COVID, we saw that really being at 58% based on the local data that we were tracking. And I'll talk a little bit about how we got that information. Our unemployment rate typically hovers around 2 to 3 percentage points above the national unemployment rate. However, because of some of the economic activity happening in Brownsville, particularly with SpaceX, y'all may be familiar with Brownsville if you track Elon Musk and his Mars. We've been seeing one of the historical low unemployment rates that Brownsville has ever had, but during the pandemic, that was really affected because we have a lot of leisure and hospitality and service retail type businesses, and those were directly hit by the pandemic. Another barrier we face in Brownsville is our broadband connectivity. We're amongst the top 5 cities in the country that don't have high standards of high-speed broadband internet as defined by the Federal Communications Commission on the upload and download speeds that are considered to be the standard nationally. During the pandemic, Smart Asset conducted a study on our area, and they determined that 78% of our employers were not able to offer remote work, and a lot of that was attributed to broadband connectivity challenges. What we were able to do during the pandemic is a lot of the work that we were doing and a lot of the understanding that we have of who we serve and who we are as a community. That's what drove a lot of the decision making. A lot of that was complemented by this grant that we received from the New American Economy. So we were able to further understand some of our structural challenges with this funding. And as I mentioned, the percentage of health insurance coverage was higher than what we understood because of data that came from this report. And what this really helped us do is understand what measures we needed to be taking so that we could best support our community, knowing what our challenges were. Again, the immigrant community, for example, they comprise a lot of our food sector, healthcare workers, et cetera. So we wanted to really understand how we tailor our messaging, how we tactically go out to continue to build that trust with our community who is not always connected to mainstream government channels. And then also understand where we had to put our resources and what perspective we had to really take as we deployed CARES funding and local funding and things like that. Brownsville is connected with most cities right across the border, so we are a binational culture and binational economy, and really it's a beautiful community from that perspective, but it also creates challenges for us. Here's that framework that I talked about at the very beginning. I would boil it down to 3 things: the city's emergency response, our community partnership support, and the community-centered response that we took. These are the main tenets and pillars of what Brownsville did. And I'll break these down a bit here as I go forward. The biggest thing that we have to do is take care of ourselves and put on an oxygen mask. We understood that some of those structural challenges that I was discussing, we know who we are. When we understood deeper around early February 2020, our area, we knew that there was no playbook. And one of the wisest decisions that we did is we participated as part of our emergency operations center activities in a webinar through a group called Everbridge that offered pandemic planning support. And this was pro bono. We learned through our police department that this was available to us. So our entire executive team went through this process, and what we committed to do is understand what we could better do because we couldn't rely on our emergency management plans, but our community was going to need us. So through this continuity planning framework, it really set the right mindset for us, because one of the things we learned, for example, is the impact of a local public health department on matters of life or death in a pandemic situation. We leveraged that because in Brownsville, we do have our own city public health department that complemented our county public health department, but we learned that we had a true asset in the fact that we had our own public health department. We also learned that we had an asset in our fire department because it is also a fully emergency, they're all paramedic certified. So we began to learn things also in terms of timeline. We understood that pandemics take 18 to 24 months. So right then and there, I began to communicate with our governing body. Our executive team went hard to work on the strategies that we were going to have to implement to see ourselves. That, when you go back to some of the RIF cover information, I would say that what a lot of entities, and I spoke about this at the ICMA conference, the lack of the uncertainty and the lack of direction, and I would say leadership at times during the pandemic is what really affected a lot of the productivity and created a bigger impact on our employees. And that's because we had to be able to lead our employees through the pandemic because there was no way of managing it. So for example, for us, level setting and helping our team and our staff understand, I put out an email and I was doing virtual town halls on a monthly basis with them. I helped them understand that we need to hunker down because don't be surprised that we're going to be here 2 years later. And sure enough, we've been here for that amount of time. And I also told my commission on a Monday at 1:30 in the morning, I sent him an email, shared with him our continuity plans, and told him, here's what we're planning for. This is our worst case. So we learn about things such as continuity happens if you lose this level of your organization, directors, assistant directors. You had to plan in a very practical way. Also, telework. Telework was an interesting tactic for us because we really made decisions here based on our culture. We made decisions that were values-based, not so much just tactical. One of our behavioral values is trust. A lot of organizations, in my belief is that if they did not adopt telework, it was not so much because they did not have the wherewithal, the technology, the hardware, software, the VPN. It was really about trusting your employees. And for us, fundamentally, we trust our employees. And because of that, that was an easy decision to make. In addition, during the pandemic planning webinar that we went through, we learned that telework was a great risk management tool to have more staff work remotely where possible after you analyze them through this rubric that they provided. And that's what's there. All that are things that really fed the tactics that we used. We also established the BTA, Brownsville, Texas Recovers Committee. We began to implement things that were going to help make decisions more streamlined for us during the pandemic. So ultimately, the quick mobilization, total alignment is our culture. That's what our culture tagline is. Really made it a lot easier for us to make the best decisions for our employees. We established a negative sick leave pool. In other words, our employees could go negative up to 40 hours. We also never stopped doing leadership work throughout the duration of the pandemic. Very early on, our consultants that helped facilitate our leadership development throughout the levels of the organization, they came in and they guided us through a crisis-oriented workshop virtually to shift the thinking, what's called the leadership mind shift. It was based on a Harvard Business Review article. We talked about shifting our thinking from cause-oriented thinking to response-oriented thinking. In other words, there was nothing that we could have done to prevent the pandemic from happening, but how do we focus our energies on now supporting the community that needs us and supporting our businesses that need us? And those decisions, to me, paid off in helping our team be primed to execute. So in terms of execution, here are some of the things that we accomplished. Our culture, we created continuity plans. We closed down parks, closed down public libraries like many communities did, but we made certain commitments that we were not going to lay off employees. We were not going to cut hours. We were not going to displace anybody. And we were very clear about that with our employees to set them at ease. We had some non-negotiables. We told them, here's what we're committing to. And our executive team was on board, our governing body was on board. We're doing everything in our power to not have to make certain impacts. We wanted them to be engaged to help support our operations. So our library staff went off to help provide, using our 3D printer to provide shields for our transportation drivers, for our city employees, our disinfection stations. There was all these different things that our staff began to do by us repurposing them from areas that were being closed into other functions that we had. We even had staff at the EOC making food and supporting emergency operations center operations. So I think all of this helped us continue to respond to our community needs. And a decision we made very early on as well is we established the first COVID-19 testing site in the region, one of the first in the state. This goes back to us having our own public health department. Our neighboring city of Harlingen, which between us, we comprise 50% of the county's population. They joined us. So here are some of the statistics of how much we were able to do. But through CARES funding, we ultimately invested $1 million in testing. If citizens were insured, we would take their insurance. If not, it was at no cost. We covered, I believe, over 19,000 vaccines, and no one that did not have insurance had to pay a dime. We did that through our COVID-19 funding. And this data ultimately helped the city commission make better decisions on policies and the different measures and things like that. But ultimately, it boiled down to knowing your community and responding to that. Another decision we made early on is we know we have lack of connectivity. We know that our community is best responsive to face-to-face communication. That is who our community is. That's how they respond well to the material that we know they need to be provided with. So we created a Boots on the Ground campaign. This was a cross-functional effort led by our health department. Almost half of our community was covered in the first 3 months of the pandemic. Literally, there was block walking. Members of our commission were involved. Our staff was involved. They were in alleys. Those decisions paid off. Here, one of the things that I would share as a takeaway is whatever works for your community, is you need to know who you're serving. We had promotoras, which is a tool that we use to build trust within our community. Promotoras were joining us. They were going to bingo halls, adult daycare centers, businesses, et cetera, et cetera. And this was a very wise decision early on that helped us with the outreach. We also began, as we focused on our community, we expanded to helping our businesses. We have some large employers, but we wanted to hone in on our small businesses. That's who was being most impacted. So we learned that a lot of our businesses were not prepared to shift online. So we began to develop a small business training for that. We also created a COVID-19 disinfection training with our community college. We wanted them to have a certificate to display. We wanted their employees to feel more confident in serving the public. And we also then created other funding mechanisms to help provide bridge loan funding and grants, et cetera, to support our small business community. And in our downtown, we waived parking meter fees. We created parklets. We did a lot of these things that ultimately kept our small business and entrepreneurship efforts continuing to grow, especially in our downtown efforts. We had a platform, BTX Cares, that we launched. This was our landing page for all things related to COVID-19. It had layers of information. It became a major tool. We highlighted coupons for businesses, and there was just a lot of different things that we had under the umbrella of our BTX Cares page. In addition, our communications department used creative ways of communicating to our community. All of our vehicles were temporary COVID-19 ramps. We use CARES funding for this. We call this public health marketing. And we found different ways of continuing to communicate to our community everywhere. And you'll see some English language and Spanish language. So we were, very, very thorough in that regard. Food insecurity. We understood food insecurity was going to be a big issue, and it would nearly increase by almost 50%. What we did is we worked with the restaurant industry. We took a lot of our furloughed employees, hired them at $10 an hour with CARES funding. We used them on the ground to provide food to our community members. I had the pleasure of taking part in some of these distributions, and we delivered over 30,000 bags of food, and that has continued. The need has declined, but we were able to provide this throughout the height of the pandemic because of this United Against Hunger partnership, which was with various partners that are displayed here, from United Way to our local food bank to our UT School of Public Health. And here are the major lessons learned that I'll share. And I would say that investing in the organizational culture is crucial. Coincidentally, when the pandemic began to impact Brownsville, we had just wrapped up an executive leadership development program amongst directors. We focused on building relationships. By the time the pandemic began to affect us, we had meaningful relationships built within the team so that we could have a higher level of trust and make the best decisions for our community and for our employees. Another thing is, we're a learning organization. We have invested a lot in book studies and different ways of examining trends and scanning the environment around us continuously, because what's been shared a lot is the pandemic really did not reveal new issues. It only accentuated existing challenges, and it accelerated previous trends, whether it's for more technology adoption, more automation. But a lot of the issues that we have, the structural systemic challenges, they were just laid bare. So, by keeping that eye to the future, by keeping that eye to what's going on around you, you won't be as blindsided, because you will know what you're facing and what you need to be preparing for. Another thing is understand what you have to work with. In our case, we learned the value of our public health department. and our EMS, and I'll cover more on that here briefly, and also knowing our structural challenges. Ultimately, you can't do it alone. We understood that those relationships that we already had and that we continue to cultivate were the key that led to the collaboration and the manpower needs that we needed to achieve what we did in Brownsville and serving our structural needs. Here's some of those that we work with. It ranges from the Mexican consulate to our federal entities, school district, higher education entities. We also have a clinical research entity there in Brownsville called Panoramic Research. We leverage even further partnerships beyond what I can put on this slide, but that really was the key to how we accomplished our successes. Here's some additional data points. We have now delivered over 23,000 vaccines. We've held massive vaccination events. We've gone to our largest employer firsts, and then we worked with pop-up clinics, and we've gone to all of our city events as well. We are the only city that I'm aware of that has actually been vaccinating Mexican citizens. So we have a binational vaccination network that's already over 3,000 that we've had. They come into Brownsville, Customs coordinates, and we vaccinate them from Matamoros in Brownsville. So we've been able to not just take care of Brownsville, but even help take care of Matamoros, because we understand that if they're not seeing higher levels of vaccination, it directly threatens Brownsville because of the back and forth activity between our communities. So what I would also highlight here is the use of data, the vulnerability index. We created a vulnerability index with the UT School of Public Health, who happens to have an epidemiologist on board. We brought him on board through an MOU, and we called him our scientists in residence. And he helped stand up a whole new data division for our public health department. A lot of that was funded through CARES funding. We use Power BI for dashboard information. So we also created a threat level matrix where we had our own way of communicating to our community from level 1 to level 5, where we placed Brownsville, because at times we were hearing data from the state, national. We wanted to keep the data local, and we wanted to make sure our community understood that our recommendations on whether we should be a level 5 or level 3 was based on local data that they could trust, that came from the city of Brownsville, that was being produced by us in partnership with the UT School of Public Health. And then here's kind of where it goes down. Hispanic communities, as you all may know, have seen higher levels, higher death rates compared to the nation. We were at about 2.5 times what the national trend was in Brownsville when it comes to deaths. We believe that because of our efforts, that's low. That could have been a lot worse. You have seen a more pronounced percentage in other communities that are largely Hispanic. We really mitigated that. Our belief is our efforts help mitigate this tremendously. Now we're amongst some of the highest vaccination. We have amongst the highest vaccination rates in the country, if not the highest. We've been highlighted in the New York Times and the Seattle Times. If you look at our population, almost 76% of our population under 12 years old has been fully vaccinated. 90% have received 1 dose. 84.23% of the population over 65 is fully vaccinated, and that was the most sensitive group. 92.53% has received at least 1 dose. So if you look at the data, you Google Brownsville, Cameron County, we're 50% of the county. We have some of the largest rates. Here's another way we leverage our department. We had an existing mobile integrated health program, which is a community paramedicine program that proactively responds to those frequent 911 callers that don't really need emergency services. They just need other type of support. They're elderly, they think they're having a heart attack, they need help with taking the medications, non-emergency uses. We have reduced that by 50% through a program that we began back in December 2018. We modeled this after cities in North Texas. That came in handy because what we ended up converting that to is a program called MIH en su casa. So what we did is we tailored it to our community. And what we did is our department now went into the homes of the elderly and bedridden. We used the same data that this case management approach through the MIH program afforded us, and we prioritized those same community members. And the relationships were there because they knew who these individuals were, who these nurse practitioners were, who our firefighters were. So there was almost no resistance to them being willing to get vaccinated, but we tailored this and we innovated this to make it fit our community and for them to see that we were going to them and that our community, our city was about supporting our community and meeting them where they were. Our culture, some of the data that Ripka talked about, We have been fortunate to not experience some of those challenges, and a lot of that goes back to we continue to focus on leadership. I have had monthly town hall meetings with the city manager. They received, when we had our first positive case, they received an email directly from me to let them know that we've always been transparent. Communication is one of our behavioral values. And we had our first employee conference just this past month, and we asked our employees what topics they wanted to learn about. Our topics were all about total alignment, which is our culture. Our employees wanted to learn more about self-care, personal care, and how to be balanced and how to take care of total speakers to the mental, spiritual, emotional, financial, all these points that some of these points that Rivka talked about, we talked about them. And we talked about if you're out of balance, if you're out of whack, it's not going to help you be the most productive employee. Over half of our employees came in person and virtually into part of this. Recently, because of our efforts in customizing our professional development programs for soft skills, et cetera, we also were recognized by our local partner, which is the University of Texas Rio Grande Valley, for innovation in professional education, because our program is at all levels of the organization. We focus on building leaders at all levels, and we focus on being employee-centric and really capturing the voice of their needs. During the pandemic, we had surveyed our employees and asked them if they had a need for different things that were challenging, financial needs. We asked them if they had daycare needs, et cetera, et cetera. And we were willing to go the extra mile and provide for daycare support. The reason why we didn't is because our employees said that they didn't have that need. But some of those points that Rivka talked about, we didn't do, but because our employees didn't say they had that need. Otherwise, we would have been talking about how we provided seasonal staff or how we use our parks employees and parks facilities to provide daycare for our employees. This November, we'll be conducting our next organizational needs inventory, where this is a survey that we use to measure our culture. This ranges from our behavioral values to our leadership style to our communication, et cetera. We ask our employees, how are we doing? How are we doing in the area of culture and leadership? How are we serving you? And what we've asked our employees informally, and a lot of our employees have said that they trust our leadership more because of how we treated them and because of the decisions we made to make them not just feel, but really see that we prioritize them at all times. We also began to help our communities, the largest in-person career exposition in South Texas, to help with unemployment, to help our employers really recruit and come into a room together and partner with employees or citizens who are ready to become employees. That was a major win. Our unemployment rate is actually lower than it's ever been now. We're at 8.7%, still slightly higher than the national and state average, but it's very low for Brownsville. We also had reassigned personnel. We created strike teams. We supplemented our COVID-19, our call center, it's called 546 Help. We called it the COVID hotline. We put people in success in terms of what the organization needed during the pandemic. Our telework right now is at roughly 3.9%. We made it a permanent policy. At the height of the pandemic, 17% of our employees were in hybrid mode, rotating or fully telework for up to 6 months. Our turnover rate is extremely low. And the reason why it's high in 19 and 20 is because we actually ended up making structural changes to our retiree healthcare plan, or our OPEB benefits. We had unsustainable OPEB costs, and we offered our employees basically a buyout if they were to leave by a certain time and they could still maintain that benefit. Many took that, which is why our numbers were extremely high. But if you associate the direct follow-up to the pandemic, our turnover rate is less than 10%, and we've actually had employees who left come back. The use of negative sick leave banks and voluntary sick leave programs has also remained in our policy for permanently. And then one of the final things I'll talk about is broadband. Broadband, the city had already begun a feasibility study in December of 2019. So we bid it RFQ and released it in April of 2020. So during the pandemic, we were going through this Brownsville feasibility and digital inclusion plan. And if there was any validation needed by our community, the pandemic provided that. And it was perfect timing nearly because we were willing to use our own bond funds to invest in broadband. Ultimately, what we ended up doing, this plan was finalized October 2020. We went to our commission. We're working with our local public utilities board, which has an electric utility, and the decision to fund it for what's called a middle mile investment. we're using ARP funds now. So because of our proactive planning on this structural issue, we're now able to accelerate that with federal funding and not have to even use our local funding. We're tying this to our broad city efforts, really us the foundation that supports and unlocks a lot of our other challenges that we have as a community. So that wraps up my presentation. I wanted to touch on as much as I could. A lot of this is updated for 2021 data. I think overall, what the takeaway that I hope you all have is, despite the challenges that Brownsville has, a lot of those similar to what Rivka spoke to, we're able to address those challenges through our own methodology that I would say that we developed to address COVID-19 challenges. I'd be happy to answer any questions.
Well, thank you very much, Noel and Rivka. That was wonderful. For those of you in the audience, feel free to type in any questions or comments in the chat feature here in the Zoom meeting. In the meantime, I have a couple of questions. I was taking a lot of notes as you were talking through things, and I guess one more, starting out more on the specific side. Noel, you had mentioned I think your second to last slide. Your increased turnover rates of your some of your employees, and then your low unemployment levels. What are you seeing in terms of recruitment and retention of individuals into your local government, and sort of certain skill sets, key trainings, and sort of what's the outlook for that going forward, especially as we come out of the pandemic?
Yeah, so in Brownsville, government, healthcare, and education are some of the largest employers. We have a strong industrial presence, but that's primarily at the port. The port of Brownsville is about 10 miles outside our city limits. So they're seeing, they have a very stable employment. What we're seeing is that Brownsville as a city continues to be a very attractive option for many of our locals. And that's because of our broader economy, that until we diversify further with commercial industrial, which is what SpaceX is doing, we have a new vertical takeoff and landing drone company coming to Brownsville. Until that happens, most of our Brownsville remains a very attractive employer. So that's the retiree benefit did impact our rate, but that's because it was unsustainable and it wasn't being adequately funded, and we didn't have many options there. But I would say that during the pandemic, that was also a very smart decision, because our long-term liabilities were things that we began to cover before the pandemic and gave us a lot of flexibility.
Well,
did that answer your question?
It did, and so what, I guess to add on to it, so we're seeing jurisdictions around the country talk about increasing retirements, increased competition with the private sector, and just overall churn and turnovers that happened during the pandemic, putting them in a position where they're having they either currently or they anticipate having a hard time recruiting local government employees into the local government public sector ranks. So outside of sort of just your important industrial base, do you foresee any challenges specifically with your local government employees themselves in terms of recruitment and retention?
That's to be determined. I'm very interested in this upcoming O&I that we have. I think that'll give us a very good indication as to where our employees are. We're beginning to ramp up our professional development. We're career pathing a lot more, and we're engaging our employees a lot more in leadership development, and we're innovating beyond our organization. Many in Brownsville is stable to a fault. A lot of our structures were structured for post-employment, right? Whether it was OPEB, whether it was, and we weren't doing a lot to incentivize or to invest in our active employees. So we've kind of shifted. And one of the other things that we did not have is we did not have a lot of movement of outsiders coming into the organization. Since I've been there, some of our directors have come from the outside. What we're doing is we're creating management talent exchange programs with other cities in Texas. I just had a group go to Arlington, others went to Sugarland. So we're sending them out. We're sending them out to learn and then come back with those ideas. But I think those programs, while they may not always be compensation related directly, I think what they demonstrate to our employees is that we're using different ways of investing in them and keeping them engaged.
That's really helpful and a good perspective. The fact that we have a couple minutes left, I'd like you both to put on your sort of crystal ball. Your look into your crystal balls in terms of what we see post-pandemic. Noel, you had mentioned you're increasing your cross-organizational, cross-sector collaborations throughout the course of the pandemic. You're adapting innovative policies such as negative sick balance leave, enabling those to go into negative leave balances regarding sick leave, and re-examining the potential for certain positions to be virtual, either part or all the time. And Rivka had mentioned, an emphasis on quality of life benefits and quote unquote non-traditional benefits, about how those have been helpful throughout the course of the pandemic. What do we see sticking after when the pandemic ends, or when it does end? What do you think will be a lasting legacy in terms of some of these innovations adopted during the pandemic that will ultimately truly stick going forward? And do you see anything that the audience should be focused on when it comes to that as a takeaway?
That's a great question. One of our speakers that came to our conference last month talked about this concept that a group called Leadership Management International out of Waco teaches, and it's called the total person. And it has the wheel, and in the wheel you have your spiritual, mental, work, et cetera. So it's pretty much the holistic variables that impact employees. And what we talked about with our employees in a very candid conversation was there's going to be a lot of trends, right? Whether it's the 4-hour work week, whether it's telework, whatever it is, there's a lot of trends and things that are out there. The thing about it for us, I mentioned to our employees, we're willing to explore, we're willing to do what works best for our employees, right? But at the end of the day, we can't just chase every trend that's out there. We need to do best for Brownsville. And I think industry-wide, telework and a lot of these decisions, if they remain more tactical issues, I mean, Rivka has very rich data, but if the pulse on our people and our employees, if that doesn't become the focal point, which is a leadership issue. I talked about telework. I challenged some of my colleagues at the conference ICMA. I said, the issue is not telework functionally in policies. The issue in my mind fundamentally is, do we trust people? And until those issues are addressed, many organizations are going to look at the data and the research from a tactical kind of management perspective, and they have to see it through a human capital leadership lens, looking at empathy and other factors that help bring the total person to work and really support employees in the best way. So I think the question is, there's data, there's trends, doors have been opened because of the pandemic, but what will stick is what fits for the organization and what the leadership in our organizations really does to determine whether in their organization they have not the desire, but the need to better support their employees with some of these tools.
Oh, thank you for that. And Rivka, how about you? What do you see in terms of some of the lasting legacy from a workforce perspective that's going to come out? I know it's a big question, but any key nuggets?
Yeah, so I actually, Noel was lucky to get to go first because he took my H word, holistic, which is what I really think is going to be huge, is this holistic approach to employee well-being. But I think what the pandemic has done for employers is that they understand not just the benefits to the employee of this holistic approach, but also the benefits to their bottom line and for business of taking this approach, and how having employees where you're taking into consideration the whole person and how their home life affects their work life, how their work life affects their home life, what situations make them most or least productive, that really will impact, as I said, the company's bottom line in terms of their productivity, their success as an organization. And I think the other thing that Noel mentioned also is that I think is really key, and that's why I'm very happy that we were able to have our two presentations together in terms of talking about general data trends, but then diving into specifically what's going on in a single jurisdiction is like Noel had said, that it's about asking your employees what their needs are and understanding the specific needs of your population. It's it's important to understand what's going on overall in the world and in the country, et cetera, when it comes to the impact of COVID. But to have the greatest impact on your organization and on your community, you need to understand what it is that the needs are of your workforce. So as we discussed, is it that they have childcare needs? Then of course, having childcare assistance is a big help. If that's not one of the things they need, then you need to think, is it student loan repayment? Is it, what are the things that are attracting your workforce? What are the things that are helping to retain them? And how are the decisions that you're making, the things that you're keeping from the pandemic and the changes in how the workforce works, how are those helping your workers to reach their potential and to help your organization reach their potential? So I think there's going to be more consideration of maybe some things, especially in state and local government, that weren't previously considered, like telework, where that was just thought of as a no, we can't do that. You're not in person, it's customer facing, et cetera. And now thinking about, well, maybe for some positions we can do that. And for other positions where we can't do telework or it doesn't make sense or people don't want that, what are other things that we can do that help to create this work-life balance that I think as the pandemic has continued becomes even more important to individuals to make sure that their whole being is and needs are being fulfilled.
Yeah, Josh, I would just add quickly, I think one of the issues, for example, that Rivka talked about, many managers, right, have thought that there's a divide. We've created this chasm between work and life, right? The pandemic brought it together. Did it? I would argue that that's always been the case. We in our own minds have created that separation and it's time to close it. But it takes recognition, and it's not a management issue, it's a leadership issue. We have to be comfortable and willing to say, yes, that gap is closed. In fact, it's been closed, but we've only been kidding ourselves thinking that employees, who they are outside of the four walls of our organizations, don't have, there is a connection there. And we need to do more to understand that and then put programs and policies in place to support that.
Wonderful. Thank you. Thank you both for such thoughtful presentations and comments. And for those of you in the audience, I embedded the report Rivka was referencing in the chat feature. We're happy to provide copies of the slides as needed. And we appreciate your time. And again, thank you, Noel, and thank you, Rivka, for wonderful presentations. And we hope you enjoy the rest of the LGHN conference. Thank you.
Thank you. Have a great afternoon. Bye-bye.
Okay, bye.